access to dentistry in very rural areas, mental health services, and as I left the office the other day, we were furiously going through all the information that was available to look at how it matched up, what was actually in the bill, matched up to what our priorities were. But like you say, I mean, my gosh, just being able to sift through, information and pull out what you're looking for is an incredible task.
I just had a question to either one of you. If reimbursement rates are going down so quickly for providers, the cost of insurance and the deductibles are raising so quickly, what's the difference there? It's kind of, do you have any ideas on that?
Good question. In part, I mean, it may just have to do with utilization of the health system and the cost associated with that. So
have we had that many more people in the last 5 years that come into the system and receiving these services?
Yeah, it's not more people, but it may be more intensive intervention. When you do have a health problem, so more tests, perhaps more expensive technology. I know scanning is rates of various CT scans and so forth are increasing dramatically, and those are very costly procedures. And so I think it has something to do with that more intensive utilization of the system by those of us who have access to it are driving up costs, and then those costs are being spread among all different players in the system. So providers are feeling the brunt of some of that because they're not being reimbursed fully for those costs. Employees are bearing the brunt because they're having to share greater percentages of that total cost. Employers are bearing the brunt because they're paying ever higher premiums and so forth. But I think it has to do with utilization.
Thank you. This is great. I think there's one more thing, and that is there are segregated service providers. They are not in one house. And the reason that I'm saying is because of the experience in the Mayo, the experience in Montana. They have their own in-house services that psychiatrists or other physicians and so forth are in one place. You can visit them in one day at no difficulty, minimum of difficulty for the patients and so forth and so on. So in this particular sense, the economists call it the externality. You are minimizing the externality. In other words, the waste itself and so forth, by putting together. It's almost like a quad and so on. So that might be part of it.